The patient that I will be working with is Mike Smith, and he's 22 years old, and he is a male. The reason for him visiting the hospital today is because he had injuries that has sustained from a diving incident. He got these injuries from swimming and forward flipping into the water, striking rocks. It appears that his right side of his head, neck, and upper body has been injured. So Mike, the patient, has symptoms of severe pain, which had came upon when he impacted his body, and loss of sensation and movement in his arm and leg on the right side, and he may has lost conscious during the time he was injured, but he isn't sure. Me and my team has discovered that Mike has a spinal cord injury. A spinal cord injury is damage to any part of the spinal cord. Spinal cord sends and receives signals between the brain and the rest of the body. And the symptoms that he has, it appears that he has the symptoms of spinal cord injury within the loss of movement, the loss of sensation, which he has, and back pain and neck and head pain and numbness. So these are all the symptoms of spinal cord injury that we had discovered with this patient. Me and the team stated that this is a spinal cord injury due to the supportive results of the physical exam, the x-rays, MRI, and the neurological test. So let's talk about the lab work history. The blood pressure that Mike had was 100/70. His heart rate was 75 beats per minute, and his respiration was normal. Based upon the previous knowledge of the function of the spinal cord, the results from the motor and the sensory exam were consistent with that of this being a spinal cord injury, such as the decreased sensation to touch, pressure, and vibration in the right upper lower extremities, and decreased strength and movement of the right upper lower extremities during muscle testing. This will explain the numbness and the ability to feel his arms and legs. Likewise, a significant swelling present in the spinal canal in the C7-T2 region, which connects the neck with the upper back, indicates a form of inflammatory responses in that area. This is consistent with the patient's severe neck pain and ache and could suggest some form of spinal injury in that area. Brain injuries and spinal cord injuries are similar, but if the patient was to show that he was exhibiting problems with his sense of smell and taste, this could be due to like a damage in the nerve that is responsible for transporting the smell sensation from the nose to the brain, as well as damage to the processing of smell located in the centries of the brain. So we discovered that due to his symptoms, it was leaning more to spinal cord, especially with his sensation in his hands and feeling within his legs and arms. So the next step for you, Mike, I will have you get rehab due to the simple fact that you have an injury on your right arm and leg, just to get your feeling back due to like the numbness and like the tingling after like the spinal cord injury, just to prevent, well, just for you to have a healthy, sustainable life. And avoid triggers to lower the risk of automatic dyslexia, which you will have to have loose clothing, avoid very extreme temperatures, especially like in the shower, and just be cautious and avoid a lot of triggers that your body can't adore. I will also give you a steroid, which will help and minimize all the pain that you had endured from this traumatic injury. And also, you always need to take safety measures within having self-care. And if you have any other injuries that occur, make sure you seek emergency help and contact us.